All right. So for people who haven't joined us before, should we do a little introduction?
Sure.
Yeah, go for it. Tell us all about you, Kath, how wonderful you are.
Thank you. So my name is Cathy Randall. I've been an avid fan of bedside brain monitoring for many, many years now. I'm a neonatal nurse practitioner, CNS educator, and have been helping Moberg with doing some neonatal education for the last few years, on and off, as different neonatal units have started using the CNS monitor. So Tracy and I have partnered together on lots of education, and she's really the whiz, and I'm just here to support with some of the questions that I've heard when I've helped other people start using the multimodal monitoring. But huge fan of the product, obviously, and think it just has a place for those who have been doing brain monitoring for a while and are looking to kind of expand that from just one kind of aspect of brain monitoring onto incorporating, so many more pieces together and getting a more comprehensive view of the brain and how that all works together. But yeah, it's just fun to be here and to share the little bits that Tracy and I have picked up over the years.
Great, thanks, Kathy. Yeah, Kathy's so much fun to work with. She's an expert in the neonatal world, and my feet have been squarely planted in the adult world for over 30 years. But I've been bedside neurocritical care nurse and educator, and now I get to talk about all sorts of different great neuromonitoring products. And one of my favorites is the Moberg CNS Monitor. So this is our third webinar, and we've touched on various topics as we've gone. I think today we've been threatening to talk about marking events and snapshots and things like that for a while, so today we're actually going to do that. And so Kathy typically keeps track of all the questions, and we can ask those as we go along or save until the end, however we want to do it. And I think we'll probably spend a little bit of time. We'll show you the CNS monitor, talk about the snapshots, the events, some other features, and then we really want you guys to ask us your questions because we want to be able to respond to you as the users. So with that, how about I think I'm going to turn off my video, and let's see, I'm going to stop my video. Very good. Now that we've said hi to everybody, and I'm going to share my screen with you guys. And what I think I'd like to show you first is I just want to show you two slides. And hopefully you can now see this, which is a case study.
Yep, looks great.
Great. Okay. So the reason I want to show you this is a couple of things. Those of you who have heard me do training will hear me talk about this particular case, but we sort of go with the assumption that we know where this information came from. So what I wanted to show you is that these two screenshots that you're seeing are actually snapshots that were taken directly on a CNS monitor. So this is a patient that I actually took care of as a bedside nurse when I was working at the University of New Mexico in Albuquerque. And oops, location error, that's not a problem. And I use this in training because it really shows us how we can visualize trends. But I want you to see that if we use a feature on the CNS monitor that we call snapshots, we can actually take pictures of the screen and we can save those, and then we can use them to show other people. We can either show our colleagues at change of shift, or at some time, a day or two has gone by, we want to go back and look at things. They can actually be exported so that you can use them in a presentation, which is really a nice thing. But for those of you who haven't heard this case study, this was a lady that had a subarachnoid hemorrhage, and she was having some trouble with vasospasm after her clipping. And we had her CNS monitor set up to look at O2 saturation, brain tissue oxygen using the Lycox. We were using the Hemetics blood flow monitor for perfusion. We were looking at her MAP, her ICP, and her CPP. And the data displayed here on the right-hand side corresponds to this time frame where you see the yellow line. On your CNS monitor, it would be a red line. If you were zeroing in on a particular time, what I did is I used the freeze button at the top, I used the go to time button, and then I zeroed in on a particular time where her data was fairly stable and everything there looks good. If I move that line just about 5 minutes forward, what I really am interested in is you see this trend here where the perfusion really, really drops off. you see that the map drops, and actually the map starts to drop first. The map drops right at this point here. And then a little while later, the brain tissue oxygen starts to drop. So if we look over at the second snapshot, so I took another screenshot. I actually used the same screenshot, but then I just, when I put it in my presentation, I moved the line forward about 5 minutes. Then this was the data that was displayed at that time. And you can see how different it is. So the brain tissue oxygen went down to 8. The perfusion went down to 13. We know that those are very, very low levels. The MAP really dropped, and the ICP never really changed. So if we were just looking at ICP on this patient, she would look really good. But we can see a whole bunch of physiology that has changed in just a very short period of time. And the thing that caused this change, this dramatic drop in her numbers, was actually a dose of nimodipine that I had given the patient. So at noon, I gave her nimodipine, we turned her, we suctioned her, we did all of those nurse things that we do. And by about 12:20, when that nimodipine kicked in, she had a drastic change in her physiology. And the reason is because she had lost the ability to autoregulate. So she did not have the ability to maintain a constant blood flow to the brain despite the rest of the systemic pressure that was driving her blood flow. So she really needed a higher MAP to drive her blood flow and to carry oxygen to her brain. So again, just looking at ICP, she looks great. But when we factor in the other things, we really see a dramatic change based on a medication that was supposed to help the patient. So I was able to take a screenshot of what I was actually seeing. And then when the physician came to the bedside later, I was able to say, they actually were still rounding in the unit at the time. When they got to her room, pardon me, I said, you know, guys, come in and take a look at this and see what's happening. And we decided that we needed to change the dosing of her nimodipine so that this didn't happen again. So capturing things like this in the form of a picture to give it a more visual sense really helps to tell the story about the patient. You're not just reporting a change in numbers. So I wasn't just saying, you know, look, her PbTO2 and her blood flow dropped a little bit after I gave her nimodipine. This is much more impactful to be able to see a picture like this. And then what I was able to do was offload it to a thumb drive. And now it's become a very standard part of my training and my education because it's such a powerful case study as to how it helps to see all the data lined up to be able to visualize that. So I'm going to go forward one more case study. And this was a 7-year-old who actually fell out of bed at camp. He was up on a bunk and he was wrestling with his bunkmate and he fell out and he bonked his head. And this was the actual CNS monitor screen when we took the monitor into the ICU just to sort of demonstrate it to Dr. Manley. We were at San Francisco General Hospital, and he said, bring it on in and hook it up and let's see what we see. And this is what we saw. And again, I took a snapshot of it and then I offloaded it to a thumb drive. So that's the kind of stuff I want to show you how to be able to do because it really is much more impactful to see a picture. And with this picture in particular, you can see how the ICP trend, again, remember with the CNS monitor, we're looking at trends. We're not looking at individual waveforms. The trend of this ICP, it escalates up, it drops down, it escalates up again. And it's this pattern that never really comes back down to baseline. Also important with this was we had the ability, as we were watching this unfold, to mark events on the medical record in the CNS monitor so that we could see exactly what was happening and we could go back and track what had been happening as we were watching this happen. So we marked an event when we first hooked this young patient up. The second event occurred when they were actually attempting to hook up some EEG leads. So if you notice, this patient's ICP, the range goes from 0 to 50, was already starting out at quite a high level. He was already on analgesics. He had been getting some intermittent doses of mannitol. He was being slightly cooled, actually kept more normothermic. So they were already doing things to try to manage his ICP. So despite the medical management he was getting, these ICPs were still a problem. So they thought, well, I wonder if maybe he's seizing. So the EEG tech tried to put leads on at this point, and you can see his ICP spiked up even higher. So we marked that as an event. The third event that we marked here is when when the nurse tried to give a dose of hypertonic saline. So his ICP was getting more and more out of control. They gave a dose of 23% hypertonic saline, and we could actually watch the physiologic response to that. So his heart rate went up in response to the diuresis. His MAP actually came down a bit. The ICP came down some, not as dramatically as we would have hoped, and his CPP responded to that change in MAP and ICP. So if we didn't know what that event was, and we were just going back later and looking through the record, we would say, well, gee, what caused this phenomenon here? So the fact that we were able to mark events as we went along made it much more clear for folks looking back at it later to decide what had actually happened, what made a difference, what didn't make a difference. So those are the two things we want to talk a little bit more in detail about today, is actually capturing screenshots, taking snapshots, and marking events in the record, and why that's very, very helpful. Let me see if I can.
One of the things I really love about the way the screen is laid out is also how flexible it is in being able to really zero in on events and being able to scale out to kind of see that larger trend. And so maybe you've noticed that on that first one, it was a 30-minute screenshot when the other was an hour long. And so being able to zero that in and zero that out, and maybe Tracy, you can show that too as part of, you know, making screenshots and dialing in on something, how helpful that can be. And that's really nice to be able to do, especially when you're going through review. Right.
Exactly.
Does anybody have any questions, you know, related or not related? We're happy to answer that. I don't know if some of you have monitors and some of you don't. If some of you, you know, have just kind of general questions. Oh, so here's one that came in from Andre. Is it possible online to estimate index of autoregulations, PRX, ORX, or other? That sounds like an adult question.
So the CNS monitor does not calculate PRX. We actually have a product called the CNS Reader that allows manipulation of data that comes from the CNS. And through that, calculations, things such as PRX can be calculated, etc. But at the moment, the CNS itself does not do PRX calculation or any of those indices.
And so also the data could be exported out so that it could be reviewed in, you know, some sort of MATLAB or any other dialogue you might have that would allow you to do any specific calculations that you have created.
Right, that's true. So I'm going to skip out of the PowerPoint and see if I can close or at least minimize that. So let's talk about, you want to talk about mark events or snapshots, sure. Cathy? Yeah, so sure, let's talk about. So I think you could see from that second case study that I showed you that, you know, the ability to have events marked within the record was really helpful, particularly in the care of that patient, and could be helpful in the care of other patients as well. A lot of times nurses say to us, well, it feels like it's double charting. And my response to that is it's really not charting at all. So it's not considered double charting, because what it's actually doing is just giving you the ability to indicate why a trend has changed, for the good or for the bad. So mark events is a very easy way to do that, to just put a tick mark on the timeline. So Cathy, why don't we kind of show them how the event mark looks. So in your event mark, if you tap on that, you will have a library of events. And these have been relatively pre-programmed for you. But depending on the software edition that your CNS monitor has, there may be different events available. So there's actually a new version of software that has included a lot of events that are specific to the neonatal population, which is wonderful. Cathy helped us develop that. And also things that can be used to manage a ventricular drain, such as turning the drain off, opening it, clamping it, that kind of thing. But in general, if you select the category, and so Cathy picked drugs, and now we have some drug types, anti-epileptics, sedatives, diuretics, or vasoactives, then another list will open up. We've tried to include what are the most common types of medications within a category. So if she selects lorazepam or Ativan, perhaps the patient was having a seizure and we called the physician and that's what they said to give, the current date and time will automatically pop up and we can just select OK. And that would put the tick mark on the timeline. And so you will see that little blue mark has popped up on your CNS monitor. If it was a different time, let's pick a different event and perhaps change the time on it. Maybe we went to MRI and we did that a while ago. We can go in and click on the date and time and we can change that to whatever the relevant time was. And that will pop it up at a different time. So we should see 2 tick marks depending on the time that we pick. They should be right around there. Now, any of those event marks you can tap on and it will actually show you the events that have been entered. The reason I really love this is because, you know, as a nurse, you have to go back and you're charting oftentimes after events have occurred. And you kind of say, gee, what time did I give that Ativan? Time really flies. And it's hard to keep track of exactly when things are done. If you can take just a couple button pushes, just a little bit of time to document this while things are happening, you then actually have the exact time. So now you know that that Ativan was given, you know, right at the time that it's stated. So it actually can help you in your charting when you go to document on the MAR because you actually have the real time right there. So nurses have told us that that is a very, very helpful way to use the mark events. Perhaps you want to know what was happening with the patient when a particular event was marked. So for example, if I go back and tap the Ativan and then I go down to go to the event, Cathy's following along wonderfully, it'll actually put a cursor on the timeline exactly at that event time. And then we can see the data on the right-hand side. Of course, we just have question marks at the moment, but we can see the data that corresponds to that particular time. So this is particularly helpful if, say, you give mannitol or hypertonic saline and you're looking through the events and say, well, gee, I wonder what the ICP really was when they gave that medication. We can go ahead and now correlate the events with the physiology that's happening at the time. So marking events can be really, really helpful. The newest software has some features where you tap on one event and you can either just look specifically at that event or you can look at the entire list. So that's a nice kind of new feature. Events can be added or deleted from that same screen. So if we did something in error and we wanted to delete an event or add an additional one, we could do that as well. One thing to note, yeah, that's great. And, you know, the way we look at events is, do you have to mark an event every time you do something? And my thought on that is probably not, but if something that you're doing is impacting the physiology and causing a change in the data that's going to be either for the positive or the negative, it's worth marking that event. So would we have to mark an event every time we bathe the patient? Most likely not. But if we bathe the patient and it caused the ICP to go up or the brain tissue oxygen to drop or you know, something else of clinical significance, then we would want to mark that event. Cathy, can we go, let's add another event because I want to mention the category that says clinical observations. Because it's most often nurses who are using the event marks. As nurses, we are not allowed to diagnose seizure. However, we can certainly make clinical observations of a patient appearing to have seizure-like activity. So anything that might be related to seizure is going to be listed under the clinical observation. And you can go through and select any of those available characteristics that you are seeing. And this is applicable to the neonatal population as well.
And I think one of the things to just note is that when it when the device arrives to your hospital, it will have all of the, it will have just these defaults. And so you can also customize the events. So I've had some places that I've helped them to get set up, and they've changed that to, instead of clinical observations for their unit, they wanted it to be seizures ? Because they wanted, so it was still to them, it was the way that, this is things that they thought might be seizures. And so they wanted to notate it in that, the category list. So when we click here, the list, instead of it saying clinical observation, they changed it to say seizures ? And I think they maybe changed nursing care to bedside procedures. So all of this is customizable based on kind of, your own unit's kind of internal, vernacular that you might use that makes sense to you and your team. And you can, if you don't use certain meds, you can delete them off the list and make them shorter. You can, just delete entire categories that don't apply, and you could make it as streamlined as possible for people as well. And so I think, so the point that Tracy's making, so medications are always really helpful. If you see any clinical observations that are suspicious of seizures, those are things for babies that we would do as well. And then some of the neuroprotective strategies, so the cooling, if you're starting cooling or starting rewarming, those are areas that for the neonatal list, we've added in hypothermia and some of the related things to that. Maybe you are doing a midline head protocol for your premature babies and you're using mirrors for that. And maybe you want to document any changes in position or things like that. So you can customize these to really match your units and your specific practice and the things that you do for those babies that you might monitor.
So let's show them how to do that, Cathy. Let's go to the main menu and show folks if they select the events button there. You can either view the list of events, or if you go to event names, so that'll give you the same list that we saw previously. That's another way to get to it. Here is where we can add different categories. We can add names, so we can just make something up. Cooling, perfect. And then within, if we tap cooling, then we can, within that, we can actually start adding other names. So we've started cooling, we've stopped cooling, whatever the categories are you want. So again, as Cathy said, you can customize this list. You can add events, you can take them away. Now, one thing to note is that events are stored at a system level. So it's not based on a particular protocol that you might be using for your patient. It is stored in sort of the entire monitor's system memory. So these events then would always be available no matter what protocol you're using for monitoring. However, with that said, we can import and export protocols and share them between different monitors if you have multiple monitors. However, we can't do that with events. So if you're changing event selections on one CNS monitor and you have another CNS monitor, you will have to go in and manually make those same changes so that it's memorized within that system memory. So that's one thing that we don't do quite yet, is have a way to port those events between monitors. So that would need to be a manual thing for now. But I think you can see how easy it is to add categories, add different labels within categories, and customize it. That's great.
Yep. I found it just easiest to just pull the two devices side by side and to just kind of go one by one. That's how I usually, like, if we've made changes to one, then I just bring the other one close by and just kind of go through it as quick as possible. So
absolutely. Yeah, that's great.
And there is the reset to defaults, and then that allows you to just like wipe out all of the changes, and you can also reset. So if it is in the adult mode and you now want it in the neonatal mode, you can actually switch it that way too, locally.
Right. Perfect. Okay. Have any questions popped in regarding marking events?
It seems like such a silly silly, easy thing, but I think that those of you who do EEG or AEG review really can appreciate how important it is to do it, right? That these little things that we do as nurses at the bedside really make a big impact. And I think really one of the biggest gifts you can give to the nursing staff who take the time to do this is to acknowledge that they have marked events and to really acknowledge and appreciate how it's really contributed to your review. And I think that that's one of the easy little things that we can do at the provider level to really acknowledge the extra effort that they've taken to do that, to really help us paint that picture of what was happening with the patient, to make interpretation of the data easier. And so I would just encourage you to always use it, even if you click the event list and you just say, okay, great, cool, done. But just I think make sure that you don't forget to make that time to review that, because there's so much gold, especially in the neonatal world. I know more than once we've seen the notation of padding. So the baby was fussy and someone was patting the baby, and it helped to explain significant rhythmic artifact that we had. So definitely use those. They're really powerful, and customize them so that they really work for your team. Maybe you don't want all those lists and you just want 3 or 4 easy things. Just wipe it clean and make it so it's so usable and works for your team and your workflow.
Absolutely. Cathy, can you click on Mark Event one more time? I also want to bring to their attention that if there's an event that is not in the library, the very, very top choice is enter event name. So you can click on that, and if there's something that you can't find but you feel is important to indicate, just go ahead and type it in. So you can type in an event. So I think Cathy's point in really using the events is key, and a good way to do that. And I've heard hospitals tell us that they'll go in at change of shift together, the nurses or the physicians during rounds, and they'll actually pull up the event list. And then they'll be able to go back to specific events that pop out and review those more carefully, looking at that physiology on the monitor itself. And the reality is sometimes when we're giving report, we're just so busy, maybe we leave something out, and now the oncoming nurse goes into the room, pulls up the events and say, hey, it looks like the patient got some mannitol. I wonder what was going on there. And then, that's an indication to them that something happened that maybe hadn't gotten reported, and they can go back to that event and zero in on that physiology. So taking the time to mark events, it's really quick and easy to do. It's literally a couple of button pushes, and it's really helpful in conveying the bigger picture of what's happening to your colleagues and to, as review for yourself as well.
So John Baxter's made a comment saying, could voice recognition be added to streamline marking event? This is such a great idea. And I know on full video EEG, the video has audio, and that I know that in some units, the bedside clinicians are trained to use the audio as part of that. So they may say, what I'm observing is, or I'm giving this. And so certainly voice recognition is used, I know, with other types of devices and technology, but for the Moberg team watching, great idea to put in maybe the future upgrades list. Great
Absolutely.
idea.
Very good idea. Okay, let's spend a couple minutes on snapshots. So if you see a screen of interest, and I think I was able to show you that example in the PowerPoint slides, I wanted to capture that screen. If you hit snapshot, then you have the ability, if you look at the buttons down on the right-hand side, I think there's one that says Save Snapshot. You can actually save that to a library. It looks like it's not going anywhere because it defaults back to your screen. But if we click to another screen and save another snapshot, what it's actually doing is building a library of those snapshots. And we're going to save one more. Perfect. And then perhaps the physicians come around on rounds and you can say, hey, look, I saved you guys a couple of snapshots. There's some things that are interesting. They can hit view snapshot, and now we have those snapshots captured. Down at the bottom is a box where we can annotate. So if there's something that you want to indicate about a particular trend that you saw on that screen that's of interest, you can go ahead and do that. So there is, yeah, that's great. You can categorize them. You can do all sorts of annotation. So these snapshots actually remain part of the CNS data set. So when the data get archived at the end of the case, the snapshots actually travel along with that data set. So that's actually a nice thing. So after you're done annotating that one, Cathy, we're going to just have you go back to the kind of the library of all the snapshots, and I want to show them the archive button down at the bottom. So if you notice where it says archive to USB, if you put a USB thumb drive into the side or the back of the CNS monitor, depending on where yours are located and what model you have, you can actually offload that screenshot. And that's exactly how I was able to get the screenshots into the case studies that I showed you. Now, one thing that we need to be exquisitely aware of is the fact that it is capturing the entire screen, and that includes a patient name if the name has been entered at the time of admission. So up at the tippy top of the screen, right now it says no patient name, but if there's a patient name up there and that's been captured on the screenshot, just be very, very careful that you're not offloading that and carrying around data that has patient identified information on it.
Yeah, it's not like some other devices that would create, you know, just the interior part. So if I put my cursor kind of around the actual tracings, there are other devices that might snapshot or screenshot just the monitor. This is really, think of it more like you're on a PC and you've done truly a print screen. So anything you see is going to be captured. So this corner, upper left corner, no patient, this right-hand side, you know, Covidian, if I take a snapshot, the whole entire screen dimensions all the way down to the lower right and lower left, it's the whole entire screen. And so since the patient name is here, you'll always have that. So if you do have the patient name, make sure you're using some sort of encrypted drive if that keeps you compliant. And then you can, in an external program, crop that and then crop away the identifiers to use in a presentation or those kinds of things. So yeah, that's an important point.
So this is something that we don't, typically teach for the general users, because we want to be careful that folks aren't just offloading, snapshots onto a thumb drive and tucking them in their pockets. But, we did want you all to know that it is an available feature, but you do need to be very aware of the HIPAA implications of doing that, as Cathy said.
So Andre's asking a question about data collection. And so we can go through that really quick. Is it possible to collect data from ventilation directly? So from ventilators, so PIP, PEEP, and other parameters.
So that's a great question, and that's actually another direction that the Moberg company is going in. Is they have had several requests for integration directly with different types of ventilators. So I know that they have that on their list of interfaces to develop. I'm not sure exactly which ventilators they'll be starting with, but that is on the horizon. So it doesn't currently do that, but stay tuned for that. One of the things to keep in mind with the CNS monitor is it really was initially designed just to gather direct neuro-related data. Things like what you get from your bedside monitor, but also ICP and brain tissue oxygen. And then, the company was smart enough to realize that, there's a lot of other things that go into neurophysiology that, is not directly neuro-related. So we have things like our ventilator data, we have things like cooling data, we have advanced hemodynamic data. So they have been able to, at a fairly rapid pace, incorporate a lot of other technologies. So they can now integrate with Arctic Sun, some of the other cooling machines. They can integrate with the Edwards advanced hemodynamic products, the Vigileo, Pulsion, the Pico. So they are rapidly expanding their repertoire, and the ventilators are definitely on the list.
Awesome.
Okay, so I want to be careful of our time. I know we typically go about 45 minutes or so. So I don't think I have anything else about snapshots or marking events, but let's just let folks ask some questions. On topic or off topic, it doesn't matter. And if anybody wants to toss out a topic for our next webinar, go for it, and we'll write that down, and we'll think about what we're going to talk about next.
So anybody have any challenges with the event marking or any suggestions? I love that suggestion that was made about voice and those things. So, you know, ideas for making those processes easier at the bedside. We're always open to hearing that as well. Quiet group today.
It's a quiet group today. So we have a note from John from Glenside. He said he worked on the NeuroTrack EEG monitor long ago. Yes, that was one of the very early iterations of this, John. So interesting to see since then, right?
So previous webinars, I think that was the other thing you were going to show, Tracy, was just how do people access the previous ones? And we can talk a little bit about some of the topics that we've already gone over. And we're always happy to go over things again and again. I love this predictive text. Great idea, John. That was another suggestion. So voice recognition and predictive text. That would be good. So
Cathy, can you go to www.moberg.com?
Sure thing.
Wow, my
and computer. There's a question from Nick about seizure detection algorithms.
So there is no seizure detection built directly into the CNS monitor, and the reason for that, Nick, is because that would turn it into a diagnostic tool, and that is an entirely different level of medical monitoring device. So programs like Persist that do EEG reading and analytics are capable of that. And actually, one of the newer things that the CNS monitor has is a little PC that can be mounted on the back of the CNS monitor where Persist can be run actually on board. So it doesn't require Persist to be set up on external computers. It can just be run directly on the CNS monitor itself. So I'm not sure if you guys have that or not. But that might be something that we can have an offline conversation about. So if you don't have onboard Persist or you're not using Persist, then there's really no seizure detection capabilities built directly into the CNS monitor. And the CNS reader is the other product that we have for actually being able to interpret and look at the data. And that has a lot of EEG analytics that accompany that as well. So Cathy has been able to get to www.moberg, and if you actually click on the education tabs, it will bring you to, let's see, there should be a place for the, videos. There you go. If you check videos and webinars, then that actually brings up our previous webinars. We did one in August and we did one in October. And then this webinar will be posted. It doesn't take very long. The gang is good about getting these on. So you can go back and you can review the previous webinars we've done and see what they are all about.
Yeah, for example, this one we went over how to actually configure the screen. So, so say your protocol didn't have ventilation and now that's an available parameter in the future, you can go back and modify the way the screen is laid out. Or maybe for a specific patient, you don't have a type of monitoring happening, and so you can configure the displays. We talked about how to configure the alarms and alerts that can happen on the device, and then how to navigate through. So it's a really nice starter review for a lot of people who are just new to the monitor. And then here we did editing protocols, selecting the measurements, so taking a little bit of a deeper look into that. So
yeah, good.
And then this is number 3.
Yes. So if you have not signed up on the website, I would encourage you to go ahead and do that. You can actually just give them your email and actually open an account with Moberg. And what that allows you to do is to access all of the educational materials. And those, I think anyone can access them at this level, but if you want to get deeper into some of the technical bulletins and some of the other information, you can actually do that by just signing up for a little account on the website. And there's a lot of great information. So we're always posting, yeah, there you go. So we're always posting, you know, different articles, different, you know, comments from users, things like that. So there's a lot of good information there, different literature articles that come out that pertain to multimodal monitoring. So the education website and the entire website itself is really very, very helpful.
And that's just bugging out because I don't have a email server on this browser. Sorry.
Sure, no problem.
You can see it would send a little message to Moberg, support at Moberg, and it would say requesting that. And then that way they know that it's for customers, right? Is that correct, or is it for anyone?
Actually, that's a good question. So that's a good question. I don't know if they have to be a customer to be able to access that or not.
It just needs tracking.
Yeah, possibly. So John, typically for customers. Okay, Dan answered the question. So typically for customers. I mean, I'm assuming it's just customers who would be accessing the website in general. So that would make sense. Thanks, Dan. And John said that it's helpful to be aware of the archive of webinars, so you're welcome.
And John, thanks for that other idea, which I thought was great, and I accidentally pressed answered before I said it out loud, which was he had this idea that maybe that when the ventilation stuff can happen someday, won't we all be so dreamy that we could actually then manipulate our ventilation in O2 based on physiologic parameters? I think we've all been waiting for this.
Yeah, definitely.
Titrating, but I don't know that the Moberg will be able to control all those things, but I think we're all waiting for that.
Great. Okay, any last minute thoughts from folks? Any questions, any topics that you, if it's a quick question, we can answer it here. If not, we can put it on our list for the next webinar and dive a little bit more deeply. And I apologize to everyone for my screen is totally locked down. I don't know what's going on. It won't let me do anything other than view Cathy's great, helpful screen. So thank you, Cathy. I'm glad we had a backup.
That's why we're a team.
That's why we're a team. So technical difficulties. I have to get Moberg to fix my computer, and then we'd be in good shape.
All right. Well, happy holidays to everyone and everybody who watches the recording and whenever you listen to this. You know, we're just grateful for the time to chat with you and for your participation, and just, again, send us messages and ideas of other things that you know that you want to know more about how to manipulate the screen. But anyways, just glad to be with you and happy holidays.
Thanks, everybody. Happy holidays.